FDA proposes guidelines for salt added to food. The federal government proposed voluntary guidelines for the food industry to reduce salt in the American food supply on Wednesday, a move long sought by public health advocates who said the new standards could eventually help save thousands of lives. The guidelines came after years of debate, and while voluntary, still set a benchmark by which companies can be measured, something health advocates say is critical to lowering salt levels in the American diet. More than 70% of the sodium consumed in this country is already in food before it reaches the table, according to the Centers for Disease Control and Prevention. The guidelines, put out by the Food and Drug Administration, are intended to help reduce that. They apply to packaged foods like bread, salad dressing, canned soup and cheese, as well as to meals in restaurants. While a majority of Americans reports watching or trying to reduce added salt in their diets, the deck has been stacked against them, the FDA said in a statement. The majority of sodium intake comes from processed and prepared foods, not the salt shaker. Despite efforts over the past several decades to cut down on sodium, a main component of table salt, the average American adult still consumes 3,400 milligrams a day, equivalent to about 1.5 teaspoons of salt. That is nearly 50% more than the 2,300 the federal government recommends. Too much sodium can raise blood pressure, which is a major risk factor for heart disease and stroke. 1 in 3 Americans have high blood pressure. For blacks, it is 1 in 2. But there has been some scientific controversy over how much to reduce sodium. Some scientists say data has emerged showing that dropping below a certain level is actually dangerous, and raise the risk of heart attacks and other bad health outcomes. A 2013 report from the Institute of Medicine concluded that cutting out too much sodium could be harmful. David A. McCarran, a research associate in the Department of Nutrition at the University of California, Davis, said a number of studies had shown risks of too little salt.